As we get older, our cartilage wears down. It's inevitable. It happens at different rates for different people, and that can come from genetics. That can come from putting more miles through the tires. So whether you're a professional volleyball player, falling a lot, doing cartwheels, whatever it is, there's a lot of different ways to take your shoulder and put a lot of miles through it. And so as that happens, the cartilage in the ball and socket joint wears away. We have not yet in medicine figured out a way to put cartilage back in your joint. That's always going to be gone once it's gone. We call that shoulder arthritis. It can come from rotator cuff tears, it can come from wear and tear, it can come from genetics like I said, but we don't really know always why it's gone, and we don't really know how to put it back. But there are very elegant solutions to shoulder arthritis in the form of reverse shoulder replacements and anatomic shoulder replacements, or a normal shoulder replacement. Both are basically just taking out the portion of the cartilage where your ball and socket joint moves around and replacing them with metal and plastic that glides perfectly against each other and allows you to use your shoulder like normally. The difference between a reverse and an anatomic shoulder replacement really has to do with which one's the ball and which one's the socket. An anatomic is your normal shoulder ball and socket. So the ball is the portion of your humerus and the socket is the portion of your glenoid, which is attached to your shoulder blade. So that's an anatomic shoulder replacement. For a reverse shoulder replacement, we switch the socket to a ball and the ball to a socket. And the reason we do that is because it allows your natural strength of your deltoid muscle to actually take over a lot of the functions of what used to be your rotator cuff muscles. The reason we would do a reverse is mainly if you have some damage to your rotator cuff. It's very common in patients who are old enough to have shoulder arthritis to also have some damage to your rotator cuff muscles. And so a lot of people these days are getting reverse shoulder replacements. It really helps a lot with overhead motion, with reaching things on high shelves, strength, rotation externally, rotation internally, all the different motions you need your shoulder for. But the most important part of a shoulder replacement is the pain relief. That's the goal of the surgery, is to take out that bone-on-bone grinding feeling and the inflammation of the shoulder joint and replace it with something that glides well and should last you a really long time.